Hello everyone, my name is Charlotte Hall-Coates and I am the Youth Engagement Coordinator with Crohn's and Colitis Canada. I'm very pleased to have the opportunity to introduce today's webinar and to learn more from our speaker, Natasha Mistry, Manager, Patient, Policy, and Stakeholder Relations. I'd like to start by welcoming everybody to today's webinar. Today's advocacy webinar, How to Effectively Engage Your Candidate, hosted by Crohn's and Colitis Canada, we'll talk about how to effectively advocate for your issues. It will also provide pointers on how you can effectively share your concerns to candidates running for office. Before we start the presentation, some of you may be new to webinars, so I'll quickly run through how you can ask questions and how they will be answered. Right now, all of the participants are automatically muted so that everyone can hear the speakers, and so we can capture this webinar's recording without audio interference. If you would like to ask a question at any point during the webinar, simply look on the toolbar for a section called Questions, and you can ask questions to the speaker by typing them into the chat box. When you ask a question, even if the speaker is still talking, we will make note of your question and will present the questions when the speakers have finished their presentation. So please feel free to type out your questions as you have them, and we will read as many as we have time for during the Q&A portion of our webinar. If we don't get to your question, please feel free to follow up with us at advocacy@crohnsandcolitis.ca. If you have a technical question, you can also type into this box and we will follow up with you directly. If you are having trouble hearing the speakers, it may be your computer's audio settings. Try calling into the phone number provided using a mobile or landline phone. Great, we're ready to get started. So before I turn it over to Natasha, I just want to give you a quick background on Crohn's and Colitis Canada. Crohn's and Colitis Canada was established in 1974 by a group of concerned parents of children with Crohn's disease and ulcerative colitis. We are a national charity dedicated to finding treatments and cures for Crohn's and colitis and to educate people with these diseases and the public. We want the general public to be aware of these chronic diseases and the toll it takes on nearly 250,000 Canadians living with Crohn's and colitis. We also want people living with these diseases to be as well-resourced as possible to live well and manage their disease. Crohn's and Colitis Canada has funded over $88 million in research to date. That makes us one of the largest funders of Crohn's and colitis research in the world. We have more than 65,000 supporters, many of whom are actively involved in our 80 volunteer groups or chapters across Canada, and many of whom have joined us today. If you'd like more information about Crohn's and Colitis Canada, please visit our website at crohnsandcolitis.ca. I'm pleased now to introduce you to our first National Advocacy webinar, How to Effectively Engage Your Candidate. Natasha Mistry joined Crohn's and Colitis Canada in 2013 and works to improve the quality of life for people living with Crohn's, colitis, and disabilities. She graduated from Columbia University in New York with a master's degree in public administration and has over 15 years of experience in government relations and advocacy. She began her career working in the United Nations, managing governance, human rights, and democracy projects in Albania, Germany, India, and Uganda. Over to you, Natasha.
Thank you, Charlotte. Hello, everyone. Thanks for taking the time to spend this evening with us at Crohn's and Colitis Canada to learn how to effectively engage your candidates. As Charlotte mentioned in my introduction, I've made a career doing what I love, and that is advocating and making positive policy change. Right now, we're in the midst of a federal election campaign, which takes place once every 4 years, and we want to ensure that whoever is elected or currently running are made aware of issues concerning the Crohn's and colitis community. This webinar is one of 3 key activities that are taking place during the CCC election campaign. We're currently running a letter writing campaign, so please visit www.crohnsandcolitis.ca to participate. You can personalize your letter template and send it out to all your candidates in your local riding. Our campaign also includes open letters sent to each political party. To date, we've received responses from the Green Party and the New Democratic Party. You can view their responses on our website. I hope that with these activities in place, we will see some of our asks to government come to fruition. So now our goals for today, for tonight's 1-hour webinar, I really want to teach you about advocacy and really understand the need to advocate for people affected by Crohn's disease and ulcerative colitis. I want to give you background information about each of our 3 key election priorities so you feel well-versed when you talk to your candidates. I will also walk you through a quick 30-second elevator pitch that you can use when candidates come knocking at your door. These 3 key asks will also be very useful once the election is over and we do have elected members in Parliament. And finally, you will learn how to be an advocate for Crohn's and Colitis Canada, but moreover, how to do it effectively. So in this section, we'll learn about advocacy and understand the need to advocate for people affected by IBD or Crohn's and colitis. So how do we get from having opinions to actually becoming advocates? Well, let's start by all of us. We all have opinions on all sorts of issues. For the most part, we keep these opinions to ourselves. At best, we may share them with our friends or family. But basically, we share these opinions with anyone who is in our sphere, our friendship sphere, or our work colleagues, but who is willing to listen. And then there are advocates. These are people who share their opinions in an open and public environment. They have a target audience. In this case, we'll be focusing on government. Advocates are organized, and their messaging, for the most part, is well researched. Advocates are calling for social action, and they want to change the status quo for the better. So this is why all of you are participating in tonight's webinar. You want to be those advocates. In a nutshell, advocacy is the pursuit of societal improvements, making change happen. People want change because there may be an unacceptable policy or a law that might be detrimental or counterproductive. Or perhaps there is a lack of a law or policy that people want to create a new one. So when we do advocacy work here at CCC, we are focused on government relations, which simply means building relationships with government officials. Government relations is directed specifically to governments, and it targets elected officials, political advisors, and public servants. Public servants are very key in a lot of the advocacy outreach that we do here at Crohn's and Colitis Canada. Governments may or may not be aware of what the needs are of a community. So it's really up to us to voice our concerns. And candidates or elected officials are representatives, and they are usually do-gooders. They want to do good, but we have to realize that they are not the experts on our issues. It's really up to all of us as advocates to engage and inform them. In a meeting that I previously had with a government official, they spoke to me and they told me not to be afraid to come and ask for things because we are the ones who had elected them. They say if they don't know what we need, then they can't get it for us. So we really want to drive home that point that officials, elected officials, even candidates, are very altruistic in their ambitions. They want to do good in society, and that is why they're running for politics. We want to use this to our advantage because we know what are the key issues that will make our society better in terms of health care. So at Crohn's and Colitis Canada, government relations and advocacy work must always be nonpartisan. We never favor one party over the other. The reason being is you never know who's going to be in power. You never know, a government can change overnight, a government can fall. There could be changes within a party itself, and one moment a person is the Minister of Health, and the next moment there's a different person within the party that becomes the Minister of Health. So our outreach is always very broad. We also work within the rules of the system, and we use the language of government to advocate for change. We want to build a good working relationship with our government counterparts. We want to be sitting at the table behind the doors. We don't prefer to be out on the street protesting with signs. Though protest can be an effective way for change, it is really not the way that we approach government relations here at Crohn's and Colitis. We want to be at the table. We want to play by their rules. It's also important to note that advocacy work is not about converting an individual, but it's about connecting with them. It's never a my way or highway approach. It's always a give and take. It's always negotiation. We start off with small asks, and we gradually work our way to large-scale asks, sweeping changes. But we need to build those relationships in order to get there. So why do we advocate at Crohn's and Colitis Canada? We do advocacy ultimately to change public policy that will help improve the lives of people living with Crohn's and colitis. As I mentioned before, our targets are governments at all levels. However, at times we will work to make change with other partners, or we'll target our change at other partners. And this could include private insurance companies, for example, or businesses. So why do we advocate, and why is there a person like myself doing lobby work? Well, really, there are 4 key reasons. Number 1, we are the experts. CCC wants to be seen as the go-to organization for information education, and it can share cutting-edge research information with elected members. CCC is the leader in improving the lives of children and adults living with IBD. We have the knowledge, the expertise, and the experience and insight on IBD. We also have a large network of GI specialists, nurses, some are on the call tonight, researchers and clinicians to provide us with scientific information. Number 2, we are the ones who are able to advance our issues on political agendas. Our strength is really in the number of people affected by IBD. We can mobilize a large grassroots network. We have 65,000 members and 80 community groups that include chapters, affiliates, and Gutsy Walk committees. And through our advocacy activities, we have identified political leaders, policymakers, civil servants who have a direct connection with IBD. For example, even Prime Minister Stephen Harper is a donor to CCC. He donates every year. So we do have the ear of some of these key political leaders. We have a community, including yourselves, who have taken a keen interest in advocacy to make candidates aware of what they can do to make a difference. Number 3, we have the solutions. We have practical solutions that can challenge or overcome some of these healthcare challenges that we face. From our community, we can come up with we have problem solvers who know how to improve the laws and what new laws we need to introduce. And through our networks of GIs and nurses that specialize in IBD, we have models of care that work for patients and can become widespread in Canada. But we need to know how to channel those best practices to our politicians. Number 4, ultimately, we want public policy changes. There is no doubt that the Canadian healthcare system needs improvements, and we can offer practical ways to ensure that we have better access to care, since we have a better understanding of healthcare. And some examples can include introducing laws and policies on improving washroom access, and even calling for the establishment of a national pharmacare plan. And that's the key issue we'll deal with later on in this webinar. So just to wrap up this part on advocacy, I provided an illustration that should give you an idea of how our Canadian government system works and where our issues align. So if you focus on the left side of the illustration, I've highlighted the main levels of government from federal, provincial, regional, and municipal. Municipal is the level that is closest to the people. Sometimes, I've added regional in there because sometimes people see this as an additional layer of government, but in Canada, regional government doesn't really have as much political clout as the other levels of jurisdiction. Now, on the right side, you will see some IBD-related public policy issues. According to our Constitution, there are certain key issues that fall within a specific political level of jurisdiction. For example, health falls under the provincial jurisdiction. However, and there's always a however, those boundaries can blur depending on the issue. For example, at the federal level this year, drug abuse has been a key health concern and has been Health Minister Ambrose has taken a lead on developing initiatives that counter against drug abuse. So, you know, these are where you'll see a lot of federal issues on healthcare kind of play out on the federal arena as opposed to the provincial one. In the middle part of the illustration, I've highlighted where staff and volunteers would focus their advocacy efforts. In this chart, what you really need to understand and take away is that health in general is a provincial issue, so you will rarely see it as a main key topic of debate at a federal level. So how does this affect us in the federal election, and what will we have to talk about when candidates come knocking on our door? Well, like I said, even though the delivery of healthcare can fall within provincial jurisdiction, we find that there are national needs that affect Canadians across the board. And it makes most sense to direct our energies for changes at the federal national level. And so some of those issues that I've brought up here that we will discuss further in detail tonight include access to affordable treatments and disability issues, such as washroom access. So we look to the federal government to take national leadership of issues. And this is a key election where healthcare has not been on the federal radar for a long time. And we found that because healthcare hasn't been part of that federal agenda, other pieces are moving around it to make sure that it does become a federal issue. For example, we've seen a lot of provinces creating more national bodies that are working more closely than ever to come up with national ways to improve our health care, to improve drug access, to improve and streamline drug approval processes. It's really about time that the federal government participate in those discussions. So we're going to move on to the second part, and if you have any questions related to advocacy, I encourage you to add your questions or type up your questions in the questions box, and we'll address it at a later point in time. So now to run through our key federal election asks. I won't dwell in these in too much detail. I really want to provide you with some background information that will help you speak freely and show your knowledge in each of these asks. So we're really calling for commitments from federal candidates on the following three key issues. Number one, improved access to and affordability of treatments. In here, we're talking about the limited number of available treatments for those with moderate to severe cases of Crohn's and colitis. Even though we have a national or federal level health body, Health Canada, that approves new treatments that will help patients and also help those who fail to respond to current treatments. They review and approve all drugs that come into the Canadian market. These treatments help people achieve remission, allowing them to get back into the workforce and school. We need to ensure that these proven treatments are placed on public formularies in the provinces across the country. So we are calling to improve coverage and improve the number of treatment options available. This links in nicely with our call to establish a national pharmacare program. Canada is the only developed country with a universal healthcare system without universal coverage for prescription drugs. As I mentioned before, each province manages its own drug plans, and as a result, we have a hodgepodge of varying degrees of coverage across the country. It's really time for change. Canadians need a national pharmacare program to get access to the drugs they need, no matter what their income level is or where they live. In our second issue, we call on improving washroom access. As we all know, living with Crohn's and colitis means being close to a washroom wherever you go. And during times of active disease or flare-ups, patients can experience between 5 to 20 or more bowel movements a day. The constant need and dependency on a washroom creates anxiety and fear that makes it really difficult for people with Crohn's and colitis to carry out daily activities at work, school, and home. So we at Crohn's and Colitis have created the GoHere initiative, and it's a short-term initiative that will help us reach our long-term vision. GoHere encourages businesses or existing washroom facilities to be open and accessible to people living with any type of incontinence. What we do need is guaranteed access to all public washroom facilities so that no one is refused access because of their medical condition. Our third ask focuses on increasing funding for IBD-related research. Canadians have more reason to be concerned about Crohn's and colitis than anyone else in the world. We know that 1 in every 150 Canadians suffers from Crohn's and colitis. It's a rate that ranks highest in the world. We need greater investments in research to find cures for IBD and to address this growing health concern. We'll now look at each of these issues closely on the following slides. So issue 1, I've laid out all the recommendations that you can use when you have these discussions with your candidates. As most of you know, treatments have come a very long way, and with technological advancement, we're learning more and more about how to treat IBD and to get these diseases into remission. There are various types of treatments out there, and with them come different levels of access and different levels of cost. In Canada, we particularly face a number of challenges when it comes to access and affordability. Number 1, there are a limited number of available treatments for those with moderate to severe cases of Crohn's and colitis. I want to focus on biologic drugs, and these are drugs that are produced from living cells. They offer numerous benefits, and in fact, there was a study that took place in the U.S. that looked at the economic cost and the shift in the burden of care for Crohn's disease. What it did was it looked at hospitalization rates, outpatient rates, and medication costs over a decade to compare and look at the costs and where that burden of care lay. What was observed was that the introduction of better medications, meaning the biologics, they actually lowered the cost of care for hospitalization and outpatient care. Biologics have also been attributed to the lower rates of surgery. In Canada, we do have several biologics approved for Crohn's. In comparison to other countries, and specifically I want to call out countries in Europe and the U.S., Canada unfortunately lacks the variety of treatment options. Even within our country, there's a discrepancy across the country with respect to the status of coverage for a drug product. Provincial drug programs can still refuse to pay for new drugs even after they're approved as safe and effective by Health Canada. When it comes to biologics for ulcerative colitis, unfortunately, there are no drugs approved on provincial public formularies to date. We want a greater number of options available for people, options that will work in case people become non-responsive to current treatment. We also want options that will help people avoid surgery unless it is deemed necessary by their GI. Another point is that Canada does not have a national pharmacare plan to help cover the cost of drugs. Drug access is important, but unfortunately it's not part of the Canada Health Act. This is the act that outlines what is covered under the government public program. In fact, drugs dispensed outside of hospitals are not covered, with a few exceptions in the provinces. We do know that in 2012, the total amount of prescription drug spend in Canada was $27.7 billion. Less than half of this, about 44% of that drug spend, was paid by public insurance, and 55% was paid by private insurance. While a majority of Canadians obtain drug coverage privately, there is still a significant proportion, and it's estimated to be at about 40% of the population, that depend on public drug programs. Even those who have private coverage may not be getting adequate coverage. So we call on election candidates to increase the number of treatment options for Crohn's disease and ulcerative colitis. And we believe that the creation of a national pharmacare plan will help us achieve a national, across-the-board standard that will make drugs like biologics affordable and accessible. So we want to make sure that with a national pharmacare plan, no Canadian is forced onto a different course of therapy or forced into surgery solely for cost reasons. Moving on to issue 2, I want to focus on washroom access. We're asking for 2 pieces here when we look at washroom access. Ideally, we want to encourage government to enact legislation that will guarantee access to public washroom facilities. Number 2, we want to encourage all levels of government, municipalities, provinces, and even federal buildings to participate in the GoHere Decal initiative. I just want to highlight for you some statistics. You know, we've all been in a situation where we've needed to access a washroom quick and haven't been successful. And so the lack of facilities really discourage people with incontinence from venturing outside of their homes. In 2011, CCC, our organization, conducted a national survey to understand the impact of washroom access. And I think you'll find some of these statistics really shocking. We found that over half, 53%, had to actually negotiate and share private details of their condition in order to use the washrooms. We also found that the majority of the respondents taking the survey were denied washroom access in the following businesses, so retail, restaurants and cafes, in grocery stores and gas stations. This could be appalling because, you know, we think of these places as places, go-to places when we're in need of a washroom. This resulted in over 80% who chose to stay at home during a flare-up because they feared not being able to access washrooms. It's really shameful in Canada. We lag behind legislation and we need to do more. In the US, for example, there have been 14 states that have enacted legislation that enforces businesses to provide washroom access, particularly for those living with IBD. For those of us who have traveled to Europe and Japan, washroom access is available. There are portable washroom facilities in all public spaces. We do have a bylaw in the City of Toronto that enforces retail establishments that are over 33 square meters to provide separate male and female washrooms. Though this is not specific for people suffering from incontinence, I think that this is a great example that we can cite when we have pushback and we talk about enacting legislation to the candidates. So while we work to get this national legislation, CCC has created a pragmatic and innovative solution where businesses in the community willingly open up washroom access. So I just wanted to take a minute to focus very quickly on GoHere. For those of you who don't know, GoHere was launched recently in Calgary and endorsed by the Mayor of Calgary, Mayor Naheed Nenshi. And there are 3 components to this project. You can see the website there. If you want to learn more about it, you can go to that website. But the 3 components include a decal. So one part of the project is to reach out to existing washroom facilities at businesses and ask businesses to open up their washrooms and to talk to them about Crohn's and colitis and incontinence in general. And if they agree to do that and participate, they will receive a GoHere decal, and that's the sticker on the right side of your screen, and they can post that on their storefront windows. This signals to our community as well as communities that are experiencing incontinence, people living with diabetes, MS, Parkinson's, et cetera, they can also use those facilities. The second component of GoHere is the launch of a Washroom Finder app. It's a free app that uses your phone's GPS system to identify washrooms in your location, in your area. This is a national app, and people can always add new locations. You can rate existing locations, and even find washrooms en route to a destination. If you're interested in downloading the app, you can go to that website, and it will give you instructions on where to go to download it. The third component of GoHere is our washroom access card. We've heard from many people in the community that it would help to have proof of medical need. And so this card for now is available virtually through the Washroom Finder app. You can download this card. It shows your name and it alerts any business that you show this to that you have a medical condition and you need access to the washroom immediately. We do hope to launch this a downloadable version or a printable version on our website very soon. So some successes of GoHere is, it's been quite easy to reach out to municipalities. It's a very easy ask. And so far to date, we have on board a few municipalities that have agreed to post GoHere decals all over their municipal buildings in Barrie, Calgary, Mississauga, and we hope to be launching GoHere in municipalities at Ottawa and in Burnaby, BC. So moving on to our issue 3, we're really focused on investments in IBD research. What we want to do is we want to ask the government, just a very general request, is to increase their funding for IBD-related research. And, some of that money could also help establish, support new models of care. And, when I was talking about providing solutions to the problems, this is one such example where, building multidisciplinary teams of medical professions, it can help enhance patient care and support research work at the same time. So Crohn's and colitis is currently the largest non-governmental funder of IBD research. And to date, we've funded over $88 million. Last year alone, we invested over $7.5 million in research, which helped us to support 37 different research projects and 22 trainees. However, like I said, more funding is needed. We need to help address the growing IBD population in Canada. It can also help us develop new models of care, such as developing IBD centers of excellence that improve diagnosis, treatment, research, and help promote integrated care. We do know from evidence, scientific evidence, it suggests that the best care for IBD patients will involve services provided by a multidisciplinary team. At the Center of Excellence, patients would receive the focused care they need from chronic disease management teams, including doctors, gastroenterologists, nurses, researchers, dietitians, psychologists, and social worker. All of these people working together on one individual file to help improve health and reduce the burden of disease. Research work has been done in BC. We received some funding from the BC government to help us explore the possibility of expanding the multidisciplinary care model across Canada. There are current centers that are considered IBD centers of excellence, and these include centers in Calgary, Edmonton, McMaster University, McGill University, Mount Sinai Hospital, and there is a center in Winnipeg. Also, we do know that Israel has established IBD centers of excellence, and we look to other models of care to kind of learn from their examples. Even within Canada, if you look within the healthcare sector, Multiple Sclerosis Society and Cystic Fibrosis have established clinics that provide integrated care and undergo research work. But to get there, we do need more funding that will help us, and we need more funding to help us find the cures. So again, if you do have any questions, I encourage you to go to your questions section on the webinar and type in your questions if you have any regarding any of these 3 priority issues. I wanted to, for the final part of the webinar, I wanted to move on to really the most exciting section, talking about effectively engaging your candidates. So now that you're well equipped and you have some information about each of our 3 key priority issues, I wanted to help you develop a 30-second elevator pitch that speaks to these key asks. So if you can imagine, even with anything, having a 30-second elevator pitch tucked away somewhere in your mind is a really great resource to use when you stumble upon a candidate, for example, or someone else who's unaware of the issues for people living with IBD. When you do meet with a candidate, it's an opportune moment to make an impactful and effective pitch. So in 30 seconds, what you want to do is first introduce yourself. Second, talk to the candidates about Crohn's disease and ulcerative colitis. Ask them if they know about these conditions or these diseases. Third, tell them that there are 3 key issues you want their commitment on. And 4, ask them about follow-up. Do they have a website or a Twitter account? And if you're Twitter savvy, try to connect with them, be their follower. So if I was to prepare an example 30-second elevator pitch, this is what I would say. Hi, Elizabeth May. My name is Natasha. Did you know that Crohn's disease and ulcerative colitis are lifelong diseases? And for some unknown reasons, they cause inflammation in the gastrointestinal tract. These are Canada's diseases, since our country has the highest rates of prevalence and incidence in the world. During times of flare-up, did you know that people with Crohn's and colitis need access to a washroom? and washroom visits may occur 5 to 20 times daily. Sadly, there are no cures and access to treatments. As a candidate, I would like action in 3 specific areas. Number 1, I'd like you to help us improve access to treatments and help develop a national pharmacare plan so people like myself get access to proven treatments. Number 2, we really need greater washroom access. Do you think you could help develop a national policy or legislation on that issue? And 3, we need to find cures. Increasing federal funding to find cures and improving treatments will be very helpful in the long run. If you have a Twitter account, Elizabeth May, or even a website, I'd be happy to connect with you. Thank you. So this is just to quickly show you how you can pull together your key issues and to quickly explain what the diseases are and list some statistics and facts, something that will make this meeting memorable for them. So again, just wanted to quickly go through those tips. Make sure that in your conversation you develop a connection in your introduction. Ask if they know about Crohn's disease and ulcerative colitis. Find out what that connection is. And please feel free to speak up and introduce your key issues. And remember to be nonpartisan in your discussion, especially if you're representing Crohn's and colitis during these discussions. Now, one of the last few slides, what we did here is with our new staff support, Aisha, she's taken stock and done some research into each main political party platform addressing health issues and social issues. And I think that this is a fantastic chart for all of you to have a closer look at. I know the writing might be very small, but we will be posting this chart up on our website. But it's a good snapshot to have a look at what each party, where each party stands in terms of healthcare and social issues. Please note that these charts are in no way an all-encompassing view of healthcare policies. We have simply selected the pieces that we feel relate directly and indirectly to IBD. So just to quickly go through this, with no mean intention, we did see that the Conservative Party of Canada really hasn't released any key platform issue on healthcare. I think that this is pretty much in line with what the current government has been doing. They truly see healthcare as a provincial issue, under provincial jurisdiction. Though, through our previous outreach efforts to the Federal Minister of Health, she did make mention of the need for greater collaboration with provinces when it comes to talking about healthcare. When you look at the other 3 parties, there are definitely a lot of commonalities amongst them. You'll see that all parties, the Green Party, Liberals, and NDPs, are committed to the renegotiation of the health accord. If you remember, this was the agreement that had expired under the Conservatives last year. It's an agreement that had been created a few decades ago between all provinces and territories and the federal government to describe the health transfer payments. The Liberal and Green Party also call for universal pharmacare, and it aligns well with one of our key issues. The NDP, though they haven't come out to say that they're calling for universal pharmacare, they do address the issue and they call for the creation of a catastrophic drug plan. And this plan would focus on helping the most vulnerable cover the cost of drugs associated with major diseases. So if I was to look at the social issue, looking at the next slide, you can see here that most of the issues across the board, across all parties, focus on people living with disabilities. It seems to be a very key, strong issue at the moment. Both the Green and NDP party have announced intentions to create a national disabilities plan. The Conservatives, who were the party to bring in the Registered Disability Savings Plan, the RDSP, they have promised to increase the government contribution that goes into the RDSP. They also pointed out an interesting piece where they will promise to invest funds, $35 million, to help integrate people with disabilities into the job market. I wanted to also flag an important policy piece that's found within the Liberal platform, and this is with respect to expansion of the EI, Employment Insurance Compassionate Care benefits to caregivers who care for, they're looking at expanding the definition of who qualifies to caregivers who care for seriously ill family members. I think this is an important piece to note, particularly for our community, as it would then allow people, caregivers of people living with Crohn's and colitis to qualify for this EI benefit. You know, Crohn's and colitis, we take pride in this because we have been working alongside with other members who belong to the Health Charities Coalition of Canada, and that's all the major charities, health charities in Canada, to get this on the government agenda. And earlier this year, we were successful at actually expanding the length of the EI benefits from 6 weeks to 26 weeks with the Conservative government. This piece that is being carried by the Liberal Party is a second part to our ask to government. So in this last slide, I really wanted to highlight some tools that you can use that will help you guide your advocacy work and reaching out to candidates. You know, there are 7 steps I've highlighted here that will help you take action. So step number 1, I recommend that you know your electoral district. There has been some rejigging of ridings at the federal level. We now will have 338 ridings across the country. That's approximately 30 more than we did at the last elections. You should know what your riding name is, and you can find that out by going to the elections.ca, Elections Canada website. Step 2, you should know who your candidates are. Apart from looking at your neighbor's lawn sign, you can also get a list of candidates in your riding from Elections Canada from their website. You can also visit each party's website page. It will include a listing of all candidates with their bios, and it will be based on the riding name. Step 3, know your issues. You know, congratulations to all of you participating tonight. You did this by joining tonight's election webinar. You can read more about these election issues on our advocacy pages of the CCC website. I have briefing notes on a majority of these issues we talked about tonight, and you can reacquaint yourself with some of the statistics that I mentioned earlier in this presentation. Step 4, know your candidate's view on the issues. I highly encourage you, if you haven't done so yet, join our letter writing campaign. It's a really great way for you to get the issues out to all of your candidates. You know, you may not have the opportunity to speak with them in person, but you can take this opportunity to write them letters. And there's an ability for you to adapt the letter and to add your personal story if you wish. You can also follow your candidates' Twitter feeds. A lot of the election is being played out on social media. So really, you know, join the action, be part of that, follow your candidates. Step 5, know each of the parties' views on the issues. You can actually, you know, if you want to do some interesting reading, it might be long and drawn out, but you could read party platforms. Or you could take a look at our political party platform chart that Aisha had developed. We will soon post this on our website, and we will go through it and update it every week up until the election period as new pieces come out into the media. You can also watch the leaders' debates or follow nightly news coverage to get an idea of what each of the candidates are saying. Step 6, know what other related health organizations are asking their candidates. You might want to peruse or visit other organizational websites such as Research Canada or Stem Cell Canada. Read their position statements, learn about their election campaign platforms. You might learn something new, but it can also help address some of the issues that we're talking about at Crohn's and Colitis. Often a lot of the asks that we have are in harmony with a lot of other health charity organizations. And step 7, if you can, try to meet with your candidates. There are many opportunities to do this. Some of our volunteers have attended town hall meetings or locally held debates with their local candidates. A lot of candidates go door to door. Don't be shy. Open that door and talk to them and tell them exactly what's on your mind. They're there to listen to you. And again, I just want to reiterate that, politicians really do want change. And they need to know about our issues in order to take them on and to champion them. So take advantage of that opportunity to speak with your candidate, because you never know, they might be, the next Minister of Health. So if you do manage to connect with your candidate, let us know. Send me an email, and we would want to identify these champions for change. And so now I come to a close, and we'll take some questions, but I've included here my contact information in case you want to follow up with me and tell me about one of your candidates, or if you want to practice your 30-second elevator pitch, I'd be open to listening to you and helping to coach you on that messaging. So in a nutshell, I hope that you feel better equipped now to reach out to your candidates for the upcoming federal election. And if you want to learn more about our issues, I strongly encourage you to visit our advocacy pages on our website. And I want to thank you for spending your evening with me to learn about advocacy and to help become key advocates for CCC during the election.
Thanks so much, Natasha. That was a great presentation. And now I'll pass it over to my colleague, Aisha Mian, Patient Programs Coordinator here at Crohn's and Colitis Canada, who will facilitate the Q&A portion of this webinar. So over to you, Aisha.
Thank you, Charlotte, and thank you, Natasha, for the great presentation. It was very informative. Just a reminder to all the listeners, if you have any questions, please submit it in our questions box, which can be found in the toolbar on the right side of your screen. Okay, so moving on to the questions. The first question we have for you, Natasha, is what is the difference between an advocate and a lobbyist?
Thanks, Aisha. There are some differences, some strong differences and subtle differences between being an advocate and being a lobbyist. Advocates, they normally seek ways to improve government policies, and they are really volunteers because they are unpaid when they do this type of work. They're genuinely concerned about the public good, and they are engaged citizens. There's an undefined number of hours that is spent doing the advocacy work by the advocates. So if, for those of you on the call, you would be considered advocates because you do this purely for volunteer reasons because of your passion in advocacy. Lobbyists, on the other hand, are more formal structures in social action. So they're usually people like myself who are employed in these positions they're paid and they spend more hours than an advocate would in terms of lobbying because it's our job. Part of my responsibility and CCC's responsibility in terms of lobbying is we do have to register with each of the governments that we deal with. So we do have a federal registry. We do register lobbying efforts in the city of Toronto, for example, or in any province that we do our advocacy work in. And, you know, we write out some of our key messages and then we report on meetings that we've had with government officials. Whereas advocates don't need to be part of the lobbyist registration.
Okay, great. Thank you for clarifying. A second question for you, Natasha, is how can I get involved to promote the issues of people living with Crohn's disease and ulcerative colitis?
So, for one, you know, joining a webinar like today is something that can be really useful for people to get involved with Crohn's and colitis and to promote the issues. Number two, I suggest, you know, signing up to our Talk About Guts issue. Our e-newsletter provides a lot of useful information, and we do provide advocacy updates in most of our tag issues that go out, so you can learn about any event that is taking place. You know, for now, we are running our elections campaign, and you can join the letter writing campaign and send letters to all of your candidates running in your riding. You can read about the responses that candidates have provided on our key advocacy asks online during the election. And we do have hopes of rolling out future webinars where once the election is over, we will have a new group of elected officials at Parliament, and we will have webinars that talk about how you can approach your elected candidate and share your messaging with them.
Okay, thank you. Those are great opportunities. Another question is there a limit to how broad or specific your issues can be before you advocate for them?
This is a really good question, Aisha, because I think that it's always better to be more focused and specific on your advocacy ask as opposed to being very broad and vague. You know, governments usually have a lot of advocacy groups that come and speak to them, but the ones that are really effective are the ones that have one, at most two asks, and that provide them with solutions. You know, we all know that the challenges of healthcare, we don't want to dwell too long on describing what the problems are. What we do want to spend most of our time on when we do reach out and advocate are the solutions. So we need to be very specific in our asks. We need to narrow it down. For example, I can draw on our washroom access piece. You know, our greater vision here is to advocate for legislation that will help increase washroom access for anyone living with incontinence. However, our specific ask for now, as we develop these relationships with newly elected officials, is to help join GoHere. It's a simple ask. It's a pragmatic solution. And once government does join, we can begin further dialogue and ask for a more broader, greater ask that focuses around national legislation.
Okay, thank you, Natasha. I wanted to thank everyone for their questions. That is all the time we have for the Q&A part of this webinar. If you didn't get a chance to ask your question, or if you have questions later on, please feel free to email advocacy@crohnsandcolitis.ca, and we will get back to you as soon as we can.
Thanks so much, Aisha, and thanks so much, Natasha. I'd like to take this opportunity to let everybody know that we will be following up with you after the webinar via email to get your feedback and any suggestions you have for future webinar topics. We will also be sending you a link to to a recording of today's presentation. And this concludes today's webinar. I want to thank everyone for being with us today and for your great questions. I especially want to thank Natasha Mystery for sharing her expertise and experience with us all. Again, thank you all very much for joining us, and I hope we've helped answer some of your questions on advocacy and how to effectively engage your candidate.